name's Andy Whittamore. I'm a GP in the Portsmouth area. I've got an interest in respiratory care, but also interested in how we can develop primary care for the future. We've got a workload crisis at the moment, and actually there are things that we need to be doing differently in primary care, working differently, working smarter, and using skills from other members of the team to help do what we're doing better.
Hello, my name is Hala Jawad. I'm a community pharmacist. I'm here today in the GP practice. It has been a real pleasure to be here for the whole week to see long-term conditions such as COPD and asthma and managing a respiratory clinic. I think so that both pharmacists and GP have the same common interest in treating and managing illnesses and providing a high-quality patient-centered care and involving patient in the decision-making
In the community,
process.
we find that a lot of us are working in silos. GPs work separately. We don't always communicate the best with our community nurses, district nurses, practice nurses. And then we've also got pharmacists working in completely separate buildings, working very differently to how we are, but working to the same aims, and patients are bouncing between these different places all the time. So I thought it'd be interesting to work with a community pharmacist to see what they could bring to a chronic disease clinic. And certainly with my interest in asthma, I see that at times pharmacists have got a lot to offer. In Wessex over the last few years, teams have developed a medicines use review which have really transformed the extra care that patients get. And with Wessex Academic Health and Science Network, we're actually looking at how pharmacists can be used in different ways in the respiratory pathway. For example, we're looking at how a regular review with a pharmacist throughout the year can actually supplement asthma patients getting better control of their disease. So looking at the skills that pharmacists can bring to the pathway and seeing if we can work across boundaries, bringing pharmacists into general practice and seeing really how that could be delivered. Over this last week, I've worked with Hala, who's come into the practice, and seen some of my patients with asthma. And she's had time to sort of explore what we need to do in primary care, bringing her extra skills into the patient consultation. And I think that's really paid dividends. The patients who have seen Hala have been pleased to have someone different to see. They've been very pleased to have somebody with different skills and somebody they actually respect from a profession they respect. And somebody who actually understands them, they feel they understand the medicine very well. I think Hala has also learned actually there's a lot more things we do in primary care that is more than just medicines, and the patient is a whole package to go with that. And hopefully some of those skills she can take back to community pharmacists to help improve
The
patient care.
GP, Dr Andrew Whittamore, and practitioner nurses. It was a really, really nice collaboration, and I think so having a collaboration will provide a better outcome for patients. In general, I felt that the patient that I saw through the few days have been at the beginning having a closed environment, and then when we had the opportunity to talk together and they start to open up, then we have a perfect consultation time and talking about condition more than a medication and adding the medication and the technique to it. I think so had provided a more open atmosphere between the pharmacist and the patient, empowerment to talk to patients and patient understanding what's the role of the pharmacist in a GP.